distinguished guests, after evidence-based presentation, I will be moving on non-evidence-based fat treatments. This is the presentation outline. Firstly, I will be talking about conventional treatment options in ASD, and then I will move on to the identification of non-evidence-based fat treatments. I will be talking about the underlying rationality of recommendations, why although the adverse effects are seen, and why the popularity is still seen on that treatment modalities. And then I will be talking about complementary and alternative treatment uses and rates of them, and why some modalities are chosen more than the others. I will be talking about the cost-effectiveness comparison between treatments, and although the time is limited, I will be talking about popular and controversial fat treatment options. Well, primarily, this is the latest data of control centers. The estimated autism prevalence is actually 1 in 59, and in the last decade the prevalence is increased by 119%, and in the last 3 years the prevalence rate is increased by 15. I mean, the diagnostic criteria are changing, the availability for the accessibility for health service is increased, and I think they are all interrelated to each other. And this increase in the prevalence is actually affected in terms of functionality, and with the fight against autism is actually has a responsibility burden, and actually trying to find the lost piece of the puzzle is very challenging, and there's also excitement in terms of parents. And if they are not sufficient enough, and then actually we can have a good treatment modalities. We have evidence-based treatments, are relationship-based treatments, skill-based treatments, physiologically oriented interventions are seen in literature, and other than that, actually these are not the evidence-based one, and I think the most effective treatment option is the specialized and supportive educational programming, like combined treatments. And the most empirical support for a single treatment is the applied behavior analysis has the most empirical support for a single treatment, but these treatments actually take 30 or 40 hours in a week, and it actually focuses on changing one single behavior, and actually it has a burden for the parents because they have a high responsibility, and actually they are trying to find a fast solution, and the nature of the autism is challenging too, and actually and we have lots of definitive words of fads, and we have actually we don't have sufficient data about validation of its efficacy, but interventions that can be based on anti-science or pseudoscience, and this is actually discussed on internet. It sounds logical, but in a short while the adverse effects are seen and they are lost in the market, and actually they actually make the parents desperate because they cannot find the solution rapidly. Dear Özgür mentioned that in detail, but the efficacy of a therapeutic treatment should be based on evidence-based levels, and the measurability and replicability of the treatments are important, but not all the non-evidence ones are fads. And the evidence-based and non-evidence-based has a common aspect. The providers should claim to be competent in their specialty areas and need to claim to provide effective treatment. I mean, in terms of certification, there are some licensing agencies, and most of them only designate that the practitioners are qualified. But they do not always dictate which type of treatment the practitioners will provide, and this is an ethical issue. What is the competence? Well, competence is a judgment of a person's abilities, which can be highly relative according to the cultural beliefs or about the expectations of the profession. It's a very relative judgment of skills. Although licensing boards have established criteria for competence, public opinion is an integral part of attributing competence to a service provider. This is the general inclination. And actually it is unrealistic to expect the public to assess the competence of professionals using a fair criteria. It's an unrealistic expectation. And the supporters of this kind of treatments and the entrepreneurs can still support that. And I think this is the underlying cause and underlying deficiency in that. So how do parents know that an intervention is a fact-based or an anti-science or pseudoscience? Well, after the results are seen, and we have some precursors. We have some actually definitions, behavioral patterns in literature. Well, these kind of applications are seen in the media. And they are promoted by paid advertisements in magazines. They are seen on TV and actually promoted by a celebrity, and actually claims total cures in a short while and claims to cure many disorders in a short while. And what is the evidence? They are based on ideas that sound good rather than a scientifically proven one. And actually there is an one-way treatment. Actually they claim that they have the last piece of the puzzle on their hand, and other than that, well, from spiritual religions or spiritual ideas, there might be a promoting a process too, and there are actually countless opportunities in markets. So the efficacy and safety rates are low, as we said, and they have potential adverse effect rates. But why are they still popular? They are still popular because they have their own pseudoscientific claims. I mean, Well, if this intervention seems credible, especially in terms of your country's opinions, if this is a logical claim, for example, I mean, if an expert says that it works, or if several parents with children like yours say it works and it has changed their lives and they say it's promising, why not try it? Especially in a newly diagnosed people, the parents might be confused, the parents might be in despair, and this is actually a pressure on the parents, so they might incline to that kind of therapies. And because they have partial evidence, and the parents can get inclined to that kind of evidence because it's like a miraculous cure for that disease. I mean, with the news of sudden breakthroughs, accidental discoveries, and heartwarming cures actually can eclipse the persuasions of an applied science. Well, and I think postmodernist philosophies as having threatened the scientific tenets undergirding progress in developmental services today. And I think this kind of supporters generally promote these therapy modalities, and actually the public may believe the promoters. And in literature, we see that when they are asked to show evidence, they say that there are ongoing studies and precursory results are promising. These are the fixed lines of them, and they try to hide actually the poor results of that study. I mean, actually, sometimes the one who's doing the treatment doesn't really believe in the treatment itself. Well, in terms of complementary alternative treatment, this is an interactive autism network study conducted in an online study conducted in 2018, and we have 381 different treatments, most of which are complementary and being used at any time. And there's an average of 5 treatments per children, and it can be 56 and maximum. And more than 50% of them received more than 4 treatments. Well, when we have a international comparison, it shows that there's a very common usage practice in terms of CATs. And when we check the Turkey's rates, and I think the Turkey's rates are very similar with the other countries. Even before receiving a diagnosis of ASD for their children, approximately 1/3 of parents were already using CATs, as the literature shows. So, which of the treatments are selected in Turkey and in other countries? We have a cultural interaction. In USA, the biologically based therapies are on the forefront. In China, the acupuncture is on the forefront. And when it comes to Turkey, in Turkey's sample, vitamins and minerals are chosen by 84%. We have special diets. We have sensory integrations. Although there is no evidence of safety chelation therapy is used by 50%. And this is a study conducted in 2013, although the sequence is changed. We see that spiritual interventions, supplements, diets are commonly used, and there are sparse reports on vaccine drop and needles. When we compare the conventional evidence-based options and non-evidence-based health options in terms of cost effectiveness, we have a wide range of literature. In an autism children, the importance of using effective treatment is underscored when considering the cost of caring for individuals with autism. The direct and indirect costs of, and I think these results are very low. Then we check the studies conducted in USA in 2008. Actually, the budget is 90 billion per year. In 2014, actually it's up to 236 billion, and there are lots of additional costs, and it's 4 times greater than for those without ASD. And when we add the intensive behavior intervention cost, it actually 10 times greater than for those without ASD. Well, the cost of lifelong care could be reduced by 2 in 3 people with early diagnosis and intervention, and I think this is an important point to note. It's not just educational cost. After that individual is a grown person, an individual, and I think indirect results are better than expected. This is a publication. This is the ABA treatment and SIT treatments are compared in terms of cost, and I think it's a very interesting one. And some ABA programs cost up to $100,000 per year, and we have various treatment modalities, and they cost differently. And annually, it's up to 16,500 per year on this therapy. And what is the cost of doing relationship development intervention? It costs up to $10,000 per year, and it shows that the cost efficacy of evidence-based treatment looks like it's costly, but in terms of cost effectiveness, in the end you will see the effect of the treatment is more important than other therapies that may not result better for the patients. The evidence-based therapies are cost-effective and is proven by many studies. Well, the time is limited, but I will be talking about popular and controversial facts. We have 2 groups of one of them is biomedical. We have supplementaries. Well, the general usage of supplementaries are related to the ASD findings, and they are complementary treatment. It's an acceptable recommendation. And the vitamin supplementation is the most commonly used one. It's the most commonly used one in Turkey, especially CE and zinc supplementations are on the forefront, but mineral and there is a limited or no evidence to suggest that the administration of vitamin and mineral supplements beyond daily recommendations will improve the symptoms of individuals with ASD. And in addition to that, we have toxicity, we have adverse events and potentially dangerous effects. And the routine usage is not recommended after all. And we have some vitamins like B6 vitamin. This is a summary. These are the randomized controlled trials. B12 and high doses of C vitamin usage. Apart from that, if there is an insufficiency, the complementary therapies can be an option, but if B12 and vitamin C usage cannot be recommended because of the adverse event risk. And you can see the dopamine, serotonin, you can see the enzyme mechanism, and because of the relationship with the immune system, the pyridoxine was evaluated. And in clinical experience, the general result is that routine usage, routine application is not necessary. We have 2 small-scale studies for B12, and randomized control trials showed that the B12 usage is not effective in terms of ASD. Well, there are some studies actually indicates the important part of important role of the oxidative stress, but studies actually doesn't have positive results. In terms of omega-3, for example, OCD and other psychiatric disorders, it's been studied vastly, but and it's a very interesting subject, but the supplements of omega-3 and it says that it can have positive neurodevelopmental effects. This is a study. We have positive results, but when we compare the other studies, when we check the consistency rates, this is an inconsistent one, and so it's not recommended frequently. And this is a small-scale study too. This is a placebo-controlled study, and with the autism scoring system. In receptive scores, it's superior to the placebo, but there's an adverse event that it increases the rate of destructive behaviors. So, because of its potential adverse events, its safety is suspicious. We have gluten-free and casein-free diets. It's based on a suspected processing of these proteins in the brains of individuals with ASD. This is a study conducted in 2016. 15 people were included in this study. This is a randomized control trial. We don't have positive results, and in terms of vitamin and calcium intake restrictions, bone density is decreased. And the interesting thing is that at the end of the study, with the potential adverse events, although it's reported that it doesn't have an effect, more than 50% of the patients continued that treatment. And other studies show that these diets do not have efficacy in terms of decreasing the rate of obesity. Well, could you please wrap it up? Well, we have some reviews and it shows the same result. It doesn't have sufficient data. So what about secretin? It's the first recommended autism therapy modality, and the initial wave started in 1998 from Harvard. Especially clinical observation of secretin successfully being used to treat GIS and behavioral ones, and then we move on to the synthetic human secretin. And in another studies, the porcine secretin was used, and it showed that there is no positive effect. And I think allergic reactions to the porcine secretin is important. And the authors said that actually the parents believed in the efficacy of the study very much. They supported the study financially, and actually we felt pressure to continue that study, even though there are adverse risks related to the allergy of porcine secretin, and there are the secretin is not approved as an effective treatment for autism. And furthermore, it's not been tested on the pediatric population for potential harmful side effects. And another important point is the chelation therapy, and actually its harmful effects are very commonly seen, and used in ASD based on the unproven theory that ASD is related to heavy metal toxicity and mercury. This is a theory, but it's unproven, and it might be called as a detoxification therapy. But effect for ASD possess the most harmful side effects like hepatotoxicity, neutropenia, and hypocalcemia, and even death. So the Center of Disease Prevention says that actually there are death cases of this therapy. And in 2009, the studies are continued with randomized controlled trials. There are Part A and Part B groups. 65 children with ASD, one round of DMSA, and there are 3 days of a period. And it shows that there is no evidence for its efficacy on autism. And this is another treatment, hyperbaric oxygen treatment. And the studies show that there is an insufficient data for the treatment of autism. We have immune therapies too, and the first one is the EVIC infusion. In the first open-label study showed that there's an improvement in eye contact, speech behavior, and other autistic features, and as well as GIS signs were improved too. And we have 6 published open label trials, and the results are complex. So, because of the potential adverse events, this treatment modality is not recommended, and its efficacy is questionable. Now, what about stem cell therapy? Stem cell therapy is illegal in the United States, but it's still offered as a therapy for autism in many other countries, and there is no evidence that the treatment is safe or effective for autism. And in Turkey, in many centers, in private hospitals, it's widely used. If you look at the websites, I think it's promoted. It's like a holiday resort advertisement. It's a total fed treatment. So in terms of neurofeedback, the usage of neurofeedback in autism, it trains the brain to improve self-regulation of itself by providing it with real-time information about its EEG activity. There are 4 randomized controlled trials and 1 review. And there are some methodological limitations of these studies. These are the summaries of that studies that I mentioned. There is a time limitation, so I won't be giving much detail. So neurofeedback is not recommended too. Now we have lots of treatment modalities. Well, you can see very surprising treatment modalities. We have a bleach treatment. Well, actually, low dose of detergents are recommended. Maybe it says that maybe you can add it to pool water or cream. And for children, drinking it is recommended. There are no studies related to that. We have also craniosacral therapy. This is related to the paradoxical situation. When you look at the websites, there are very big claims about the craniosacral therapy that in terms of anxiety and hyperactivity, they claim that they can improve these conditions in autism, but there are no evidences, and there are lots of methodological limitations in these studies. And when you look at the videos, they promote it like it's an effective treatment and it's recommended vastly. And another one is cyproheptadine. Because of the serotonin values, this is logic is about this serotonin. Well, Ayşegül, could you please tell me the most interesting one? Well, I think the most interesting one is the marijuana and nicotine patch treatments, but these are not recommended. So what about the prism glasses? It's about reflecting various lights, but we do not have evidence or studies on that. So what they look whether cooking or heating might work. In some studies, the clinical follow-ups were evaluated. The raw one and the cooked one have the same effect. Maybe probiotic usage might be an option, they say. Well, we have some different and interesting suggestions, like a fecal implantation. I know that it's used in Turkey for other purposes, but in autism, they say that it might work because of the microbiota mechanism. I mean, there are lots of various, options, like 1,000 suggestions related to that. Although included as non-evidence-based ones, we have some controversial therapies. Well, we are very actually behind of the schedule, so thank you.